that was the PY4 physician DPP commercial equivalent calendar year 21. And then we had one that was the same name, but it was SFY 22. So I want to first level set on those two spreadsheets.
Yes. So
okay,
you are
perfect.
correct.
So then I'm going to pause here and ask Lydia Belger to ask some specific questions that she has, because she has historically done this and will be pulling the data, and she was not real clear on some of this.
Okay, no, please go ahead. I'm pulling open the anesthesia spreadsheet, so I'm looking at it right now.
Tamara Mays is from anesthesia, and then Lydia Belger is with all of the other physicians. So either of you, if you have questions specifically, please go ahead.
Okay, this is Tamara. Can you hear me?
Yes.
Okay, my question is for anesthesia. Do we just have to fill out the anesthesia tab, and then what is the fee-for-service volume and payment? That is,
so
looks like something new.
You don't have to worry about the fee for service, right? Technically, the DPP is for managed care. It is just my general practice that when I'm asking for data, I'm going to ask for it all. So for whatever reason, I don't have to come back to you later. For these purposes, if it's a lot of work or you don't want to fill it out, you do not have to fill out the fee for service columns. What we're really after is, yes, the managed care paid units of service and the total Medicaid payment. And then, of course, the conversion factors. And if you only have anesthesia services, so 00000 through 01999, then you only have to complete the anesthesia tab.
Okay, so nothing for professional services then.
No, and sometimes I do see the pain and management codes under the anesthesia. If you've got that and it's in there, you can just dump it on the anesthesia tab. I can move it over to the professional because they're priced differently. That's why we do that. But yeah, outside of that, no, there's no other reason that you should need to fill out something outside the anesthesia tab. Other than the pain and management codes, that's all I ever see outside of the 000 through 01999 codes.
Okay. That was my main question. So
it's always the pain and management. Yeah, if you just want to leave them on there, I know what code sets I'm looking for. I can move them. If you want to put it on the professional, that's also okay. It's totally up to you how you do that.
Okay.
Hey, this is Lydia. I'm looking at the professional services tab on the CY21.
Mm-hmm.
And I guess I'm just pulling in everything for for calendar year 21, right?
Yes. And when you say everything, I want to go ahead.
And the I guess this commercial allowed amounts. I mean, what exactly are you looking for there?
So what I recommend, and it depends, right? I know that a lot of times providers will have two separate systems, right? One is the claims system, and then one is the fee schedule system. So there are times I literally build these from the contracts themselves. So I'll get your contract from United, and United may say, for these codes, we're going to base it off the 2014 Medicare fee schedule. So I'll literally build it. A lot of times you guys will have your own built fee schedules for each of these payers. I would recommend getting it from your fee schedule itself for each CPT code for each payer. If you pull it from your claims or your billing system, you're probably going to have to pull multiple fields, right? Because you don't just want the amount that was paid by the payer, you also want the allowed amount, meaning the patient payment or the copay or deductible. You want the full amount of the fee that's allowed for that code. Does that answer your question?
So you're just basically looking for our CPT, who provided the modifier and everything, and the description, and our charge for that particular CPT that we build.
Yep. Okay. Not the bill charge. So in F through J, which is payer 1, 2, 3, 4, 5, the commercial allowed amounts, you would want whatever United's fee schedule says they will pay for that CPT code. And then, maybe payer 2 is Anthem. So you'd want whatever Anthem would pay for that CPT code. When you get to column N and O, so N is the paid units of service for that CPT code, and O, it's the payment you receive from Medicaid, not the billed amount to Medicaid, but the payment you receive from Medicaid.
So Lydia, so this is actually, so I'm reminded now of, this is the ACR. So first of all, we're going to take our top 5 payers.
Yes.
the commercial
Absolutely.
side, because they're calculating our ACR. So it'll be for our commercial line of business, who are our top 5 payers based on payments. And then let's just say if it's Blue Cross Blue Shield, how many fee schedules do we have? HMO, PPO, state of Georgia or something like that. Then when we get over to the professional tab, you put all the information that you have, but based on our top 5 payers that we put on that top 5 tab, you put the actual allowables that you're used to calling it in that column, because what DCH is going to do later is they're going to say, they're going to randomly pick something that maybe usually is an E&M, and then they'll say, give me a claim that matches one of those. And they're going to be looking for it to come from our fee schedule rate that we actually put there. So I can help you with that. I do recall that part. Okay.
That is 100% correct. Well said. You can come do the training with me next year. That was awesome. Any more questions? Please feel free. I'm sure any question any one person has is going to benefit everyone else on the call, and we're happy to talk them all through.
I will ask another question. So let's just play out the N and O that you mentioned. So I'm going to say for CPT 99212, not traditional Medicaid, but over in column, let's say N5, it would be for 99212 for all of the CMOs, as we kind of call them. How many units of that did you bill for all of them? Your Amerigroup, Peach State. And then of that CPT code, what was the volume? And then what were the payments for all of the 99212 summed up together?
Exactly,
right?
exactly. And it can be a little confusing in managed care, right? Because as I'm referencing the commercial plans, some of them are the same as your CMOs. So yes, that's absolutely correct. So N and O, and I'll be really clear. Don't put your billed units. And this is something that comes up in managed care a lot because it's a little bit different than fee for service. Billed units will skyrocket that ACR arbitrarily. So I'll see it right away and be like, oh, yep, there's billed units in here. You want your paid units, right? Your billed units could be 20, but you only got paid for 10 of them. So you want to make sure you get the paid units. If anyone has issues getting to that, because I know it can be hard with managed care, what you want to do is take your total paid amount and divide it by the managed care Medicaid fee schedule rate for that CPT. That will get you your paid units. Anything else, and it will just skyrocket it, and it makes it incorrect. So we'll end up coming back to you anyway. So just be very cautious. That comes up a lot.
Got it. Does that help, Lydia, with both spreadsheets?
Kinda.
And we can talk about it. I think I got it.
Right.
And please don't hesitate to reach out. Even after this presentation, there's still a couple days left. So don't hesitate to email. We can reach out offline and answer any additional questions, or if they're very specialized questions, we can answer those too.
Okay, I guess I'm going to go back. This is Tamara from Professional Solutions with AU. For anesthesia services, I put my flat fees on there, so I mean,
yeah,
I would
and
just
so
be putting the information. What
yeah,
column
Kevin,
should I plan on filling out?
if you could go, yeah, anesthesia services. So perfectly. And actually, it's funny that you asked this because I was just looking at this before the call and I realized we probably need some more lines under there. But typically it's 01978, I want to say, or 01987, one of those ones in that range. And then 01967, and those are your maternity anesthesia codes. So if you have those, just put the CPT. Put the CPT in there, and then right underneath the CPT, put the rate for each of the 5 pairs. If you have more than one, just add in a couple more rows and just CPT first. So you're going to have, so Kevin, if you could highlight rows 9 through, yep, F through J. Perfect. So, and I'll revise this next year after this question and having thought about it a little bit earlier, but like, so that will say 01967 straight across, then right underneath it, you can put your rate or your flat fee for payer 1, 2, 3, 4, and 5. A lot of times you might have a flat fee for 3 and not 2. Just put the flat fee for whatever payers you do have a flat fee for. Then if it's another code, then I would say just insert rows under line line 11, you can put the next CPT, insert a row for the rates underneath that. Does that make sense?
Yes, but do that
Perfect.
for all the flat fees?
How many flat fee codes do you have?
Well, we have pain management, so it's going to be a lot of injections.
Okay, if you have a lot of, I'm used to only seeing it with a couple of the codes. If you have a lot of flat fee rates, we might want to discuss that further offline, Kevin, and we can see if we can come up with a different way for you to fill this out. So I might say just add another tab and just put all your codes with a flat fee. Just list the code, list the flat fee, and everything else I'll have in the underlying tab beneath it.
Okay. Okay, and then I got to end the month reporting tomorrow, so you guys will be available Monday, correct?
Yes.
And I apologize, I'm only seeing your phone number. Can you just share your name for reference and organization as well?
Sure, Tamara Mays, and I'm with Professional Solutions, and we do the billing for the anesthesia group at AUMA.
Thank you, Tamara.
And Tamara, if the flat fees that you're referencing that you have a lot of are the codes outside of the 000 through 01999 range, I would then just actually recommend just jump over to the professional services tab and fill those ones out on that tab.
Okay, so just do it there.
Yeah. If that's where you're getting all those flat fee from, then I would fill it out there. I think the flat fee codes here is really the 000 because with the anesthesia and that code range, right, we have to do it totally different with the conversion factor, the 15-minute units. And so if it's the flat fees that are coming from just the standard CPT codes outside of that range, just shift it over to the professional one and that should work just fine.
Well, to me, I'm saying flat fees. I mean, it's just like pain injections,
Yeah.
office
Yep.
visits.
Perfect. Those I
So
would shift over
you
to just
need-
professional.
Okay, so do you need the description as well?
No.
My data report, I originally ran it, did not have this. And then my other question is, we going all of 21, but then we're doing the second report, 21 through June of 22?
Yes.
July of
Yes.
21 to June of 22? And they're
Yeah,
both
and I
due
think
on next week.
yes, yeah, and again, I'll just be clear. So it's not that we're trying to get all that data so we can front load and calculate a whole bunch of ACRs in advance. What we found out with COVID is there's so much flexibility, right? So you could have an ACR, the percentage itself that's based off calendar year 21, but we know that utilization has gone up, right? Because it fell quite a bit through COVID and it's steadily rising back up. So you might want to take that 21 ACR and apply it to $22. And so that's why we're requesting multiple years, because we want to make sure that we're getting everything we need so we can put together something that's going to maximize what the providers and the state are able to draw down from the feds, right, to improve that access. So that's, and I know it's a time crunch to get two different data sets. The hope and the intent, I remember pulling data is you have to pull the same thing. All you have to do is change time periods. I know it's not that simple, but it's really so that we can find the best way to put these things together to maximize that federal drawdown for both the providers and the state. So that's why there's two separate ones and they can't be aggregated. We have to have 1 year at a time. So we sent them both separately. And again, the intent is truly to find the best scenario for the providers in the state, not to make you go through tedious amounts of data for no reason.
Okay. Well, for now, I think that's all I have. And I'm sorry, did I ask about description? Do you need description?
No. And for everyone on the call, there's no need. There are certain fields, and we'll go ahead and walk back through that. As Kevin said, we'll walk through the data request again. There are some fields that no, we don't need you to fill them out at all. And Kevin, if you want to jump to professional really quick, just the professional tab. So on the professional tab, if you could scroll over to the first column. Thank you, Kevin. Okay, so CPT, we absolutely need that one, right? Provider type, we don't need that. And for your reference, right, and you guys know this, you pull data, if you're going to separate this out by provider type, you're going to have the same code listed 100 times, all aggregated by the different provider types. We put that field here because a lot of times some providers are like, hey, I really want to know how much my MDs are contributing, or I really want to know about my NPPs and what portion of the supplemental payment they are. So this is really for more detailed analysis, and it will ensure that you have a lot more lines in this data request. So you do not need to do that. There's no reason for that. Modifier, we absolutely need. These are the billing modifiers that change the rate. If the modifier doesn't change the rate and it's a lot of work, you don't need to put it in there. But that's where we want the modifiers put in. The CPT with modifier, you don't need to do that. It will only take me a second to concatenate those, so you don't have to take the time to fill out that field. Description, no reason for that. We can pull the descriptions ourselves, and we don't really need the description. So again, not a problem. Of course, the commercial payer 1 through 5, please fill that part out. And then column N through O for the Medicaid managed care paid units of service, and then the Medicaid payment, those ones you want to fill out. If it's a lot of work to grab the fee for service, or you don't really want to, again, that's totally fine. We don't need that. It's just my habit to request all the data at once so that I don't have to come back and request it later if something else comes up. But you do not have to fill out that field, especially given that there's 2 years we're asking for, and I know there's only 6 days left. So don't do anything you don't need to do if you're in a time crunch, or, you know, for whatever reason, you don't feel the need to put those things in, because we don't need them to calculate the ACR.
Okay.
And the same thing I think applies on the anesthesia tab. Again, we don't need the federal employer identification number. We don't need the rendering MPI at this point. I think we have a separate, on the first tab, we ask you to just tell us what tax IDs, are included in this for the data. So we don't need that. Again, that's just all if a provider wants to do additional analysis to dig in what's making up that result in the calculation.
This is Esther Bales with Northeast Georgia. Could you repeat again for column N on the professional services tab, how volume should be calculated or obtained? I believe you said do not put bill units, because that would be overwhelming. So what did you say earlier?
Yeah, so with managed care, I know that sometimes it's really hard to get the paid units of service, right? So you may have billed 20 units, but the claim actually only paid 10. And so you want to put the 10. So to be able to get to that, if you don't have a field that's paid units, which is very common, you want to take your total paid amount for that CPT code, and then you want to divide it by the rate for the MCO for that CPT code, right? Because that will give you the paid units of service by CPT.
Got it. Thank you.
Mm-hmm. It's very common because managed care and fee-for-service are just two different things. So, and this is a very fee-for-service way of capturing the information.
Thank you.
Mm-hmm. Any more additional questions? Okay. And again, don't hesitate to reach out. I always figure out stuff or ask questions after I have the opportunity. So, because that's for some reason when they come to mind. So don't hesitate to reach out after the fact if anything comes up. And then, I mean, we've kind of gone through the workbook in pretty good detail and talking these things through. So if anybody would like, we can kind of run through it again, or the PowerPoint. But I'll leave it open to the group because I know this is your guys' valuable time, and the people who do numbers are always too busy, right?
Yes. This is Darcy with Winsboro with Health and Healthcare. I have a question about the professional fees tab. When you're looking at the allowed amount, I know it says that you have to have it by 1/1 of 21. What if I'm not able to obtain that information?
So this comes up. The thing is, every payer could have a different effective date for their fee schedules, right?
Right.
Every payer, and it doesn't align with the rate year. It doesn't align usually with the calendar year. So what we want you to do is capture what you think most closely represents that period of time, right? If you can't get the 1/1, whatever you have that's the most closest to it is perfectly fine. And then, Kevin, if you could go to the yellow box under column F, just a little bit higher than where you're at. If you just want to put the effective dates of those fee schedules for each payer in there, we'll verify that it's kosher and it's fine. But you just want to get the next closest thing if you can't get what's being requested.
So I have 5/121 and 7/121. Would that be sufficient? Or is that too far? Okay. Okay, good.
That should
Thank you.
that should be no, that should be absolutely okay.
Okay, thank you.
Nothing fits into a square box very well, and it doesn't here either. We're trying to make it, but yeah, please, those are the perfect things that come up. Just put the effective dates in those yellow boxes. We'll verify that they're not outside of the time frame, and we'll reach out if they are. Okay, any more questions? Okay, Kevin, do you just want to jump to the instructions tab real quick? We'll just do that one in the top 5 payers because I know we haven't touched that. Those are the easy tabs, and then we'll check with everyone one last time, and we'll hopefully give you a little bit of time back today. So instructions tab, hopefully it's fairly clear. And as I said, we've kind of walked through a lot of it. The one thing is please fill out who's completing it and how we can get a hold of them. Sometimes the littlest thing can take a lot of emails to work through. So we kind of wanted to add this in so we could just get in touch with the person completing the form if there were any issues and keep the process moving forward. And again, if you have any questions about what name, what entity, what tax ID, just reach out and we'll let you know how to fill that out as well. And then I think someone else, was it Lydia? Someone else just mentioned top 5 payers. So on the top 5 payers, as was mentioned, what we need to do is you're going to aggregate all of your commercial plans, right, and figure out which one by payment has the highest, which top 5, and then you're going to go ahead and complete your top 5 payers tab. And Kevin, if you could jump to the top 5 payers tab, perfect. And as I said on the other tabs, the things that you don't need to do. So the payer name, if you really don't want to put that in there, that's totally fine. You don't have to put the payer name in there. Keep it for your own reference so that if there is an audit, if you ever get surveyed, if anything comes up, you can provide that information. But we don't need it here. Just make sure it's actually your legit top 5 payers. Total payments is just to show that, yep, these are the legit top 5 payers. Number of fee schedules. Again, somebody had mentioned, we might have 20 fee schedules for Blue Cross Blue Shield, the HMO, and then we might have 10 for the PPO. Depending on whether you list them as separate or together, that's 30 fee schedules, right? You technically don't have to do this. The reason I put this in here is if you're going to have us combine your 30 fee schedules for Blue Cross Blue Shield to get to your top 5 payers for Blue Cross Blue, or to get to your CPT rates for Blue Cross Blue Shield. If you're doing that on the back end yourselves, you can just put 1 there. If you put 30, I'm not going to look for 30 fee schedules as the key. So that field is not as important either. So again, I'm going to stop, see if anybody has any additional questions that they thought of. And if not, we'll get you guys out of here so that you can go do all those other things that I'm sure are filling up that task list.
So Randy, this is Carolyn again. I'll just clarify, are we sending it to you or are we sending it directly, uploading it to the state and confirm the due date of the 11th?
Yeah, yes, you should be, Carolyn, you should be sending it through DCH's SFTP link, which you all should have already received. If you haven't, please let me know. And I can help with making sure that you have the correct link to upload. But yes, to answer your question, please submit directly through DCH's SFTP. And the deadline is next Wednesday, January 11th.
Yeah, I have that. Okay, just wanted to confirm. Thank you.
Right.
Okay, any other questions? Okay. Well, thank you guys again. And again, if you think of anything else, please let us know. Kevin, Shauna, Brian, do you guys have anything to add before we adjourn?
Nothing to add. Thank you guys.
I am on late, of course. I'm sorry about that. Can you guys hear me now?
Yes.
Yes.
Okay, perfect. Thank you. So I want to thank everyone on the call for joining today's training. I am trying to get these uploaded for your review at a later date, and I'm still working on that. As soon as it gets posted, I will let everybody know. Sorry, I had some technical difficulties at the beginning of the call, but I'm sure Brian, Kevin, and Randy took care of everything for me. If there's no other questions, thank you all and have a great rest of your day.
Bye,
Thank you. You
everyone.
too. Bye-bye.